Let's listen to one of our panelists give his reaction. I'd like to introduce Dr. Teodoro or Ted Herbosa, UPCM class of 1983. He's a general surgeon specializing in medical education, disaster medicine, and emergency medical care. And he was former undersecretary of the Department of Health, and he is very much into e-health. Ted, a 5-minute reaction.
Hi, Yella, and good afternoon to everyone. Also to Leo for that wonderful insight on measuring quality in healthcare. That's really a very difficult topic. Probably I'm the most senior in this particular webinar. As you can glean from the year I graduated, 1983, the computer at that time was still monochrome, and we were still playing the different games, completely different from today. But the healthcare has changed. The whole system, the way to approach healthcare today is really more a systems approach and a team approach. I've worked a lot in a very chaotic environment. My field is trauma, emergency, and disasters. And to be able to standardize quality, even safety for that matter, we developed the chaos to organize the chaos into systems. So the way to look at it is, I agree with Leo in his latter part of his talk. Well, it's about networks and it's about teams. The healthcare system really works on level, wherein there are teams that work in the pre-hospital setting, in the acute care setting, in the ICU setting, in the operating theater, or even in outpatient chronic care. So the way we should measure quality should look at two things, especially for low middle income countries like ours. Part of the Department of Health before, we've looked at two things, efficiency of the health system and affordability together with the quality. And the quality can be measured as well as really the stakeholder satisfaction. Leo mentioned about how patients feel about that system delivering to them. There's actually the other component wherein how doctors feel about that. Those of you who trained at the Philippine General Hospital hear the complaints of our doctors because the infrastructure just there or the systems aren't in place to provide the quality that you want to measure. So you need to go through those levels of where the system works, and you have to turn certain control knobs so that the teamwork, the interplay of all the whole continuum of care will do happen. And yes, I agree, measuring health is very difficult. There are still no quantifiable acceptable measures. We did work for patient safety as well. If you remember, the safe surgical checklist was actually studied in the Philippines. I led that particular portion of that global study on changing outcomes surgery through a safe surgery checklist we developed at WHO. So the idea really is now that you understand the whole system. The system in the US is different, very litigious. In fact, quality can be equated to lack of risk management there. Whereas here, looked at about being able to access that particular care or modern technology where the people can use it. And I believe what he's doing at Harvard, together at Beth Deaconess, together with looking at digital networks and how to be able to study is the way to go. We're now looking at big data analytics, and I think that's the way we will be able to analyze safety and quality in the future. Thank you.